Good morning. Good morning. You're welcome to today's lecture on the course Action and Uses of Medicines. That should be Action and Use of Medicines 3, right? AUM 321. There's no marker here. What's going on? Thank you. So we look at the topic cardiovascular what? System drugs. Okay, you are familiar with the term cardiovascular, right? So cardio means what? The heart. Vascular talks about what? The vessels, right? So cardiovascular system alongside the the lungs and the pulmonary system play a vital role in what? Circulation. Three of us do. They play what? Vital role in what? Circulation. Before we go into drugs, there's need for you to understand. If you don't know what the heart is like, if you don't know about the structure and functions of the structures in the heart, and if you don't know about the pathology of the heart, the pathophysiology of different diseases in the heart that in the of the cardiovascular system, you'll not be able to know what drug we do there. Three of us, you will not be able to know, and you'll just be doing guesswork, possibly cramming, because you need to understand where the drug, what happens under normal circumstance. That is the anatomy and physiology. What happens under normal circumstance and what happens in diseased states. Before you can think of what the drug you want to administer will do in those different parts of the world, the body. So without wasting time, of course, you know that the heart is an organ, right? At the same time, it's a muscle. True of us, yes, it's a muscular organ because of the contractile role it plays. Because without the contraction, there will be no what? Pumping of what? Blood. Okay, so now to tell you how busy the human heart is, in the body, the volume of blood in the body is around 5.6 what? Liters. Am I computing? Around 5.6 what? Liters. But the heart pumps up to how many gallons? You know what that means? How many liters make 1 gallon? How many liters make 1 gallon? Roughly 4 liters. Roughly. Roughly what? 4 liters. Make what? 1 gallon. Am I computing? Am I computing? Good. Roughly 4 liters make what? 1 gallon. Three of us, you don't know. Look it up now. Look it up, sharp, sharp. Look it up and confirm. That's how we learn. Look it up. If some things are mentioned, you look it up to confirm it sharply. So in my class, ensure that your data is on. I keep saying this. Ensure that your data is on in my class. I allow you to use your phone. Check it up. That's how we learn. Check how many liters that make 1 gallon. Let's see what it is. Okay. Well, while they check, let's continue. How many liters make 1 gallon? Three what? Roughly 4 liters. Roughly what? 4 liters make what? 1 gallon. Now, the volume of the blood in the body is 5.6 liters. Just 5.6 liters of volume of the what? Blood in the body. But the heart pumps up to what? How many gallons? What around what? 300 gallons of blood per day. Do you know how many turnover? It will turn over the blood in the body to get 4,300 gallons. Okay, how many? If 4 liters is 1 gallon. So how many liters are in 4,300 gallons? You multiply by what? 4, right? Three of us multiply. If 4 liters is 1 gallon, so 4,300 gallons is what? How many liters? 7 what? Good. We have 17,200 liters. The heart pumps out 17,300 liters of blood in a day. Now, if you want to know how many times you turn over the blood in the system in a day, divide this by 5.6. What's the answer? I'm trying to point out how busy the human heart is. The heart is, how busy it is. Divide 17,200 by 5.6.
3071.
3 what?
071.
3071. So in a day, the heart turns over the blood in the whole system 3,071 times. Because you know that all okay, this one we did this one I said now. Let me go straight trying to explain what actually happens. You know that all the blood in the body, they must return back to the heart. 3 of us, and go out again. 3 of us, they must return back to the heart, go to the lungs, get oxygen, drop carbon dioxide, and come back to the heart. The heart will pump it back to the what? The system. The one the heart is pumping back to the system now has oxygen and what? Nutrient, right? Remember, it's also passed through the what? The GIT to get nutrients. Remember, from your what? Assimilated what? Food. Remember, and they now go and come back again to the heart. This is how they keep coming back to the heart, leaving the heart, coming back, going to the lungs, go back to the heart, portal system, come up. This is what it keep doing for 3,071 times in a day. So the heart is a very busy organ. Very, very busy. That's why when the heart has issue, I'm sorry. Sorry is the what? The name is a very vital organ alongside your liver. Is that what? Is that what? Even lungs too. Now, okay, with this now, I just use this to introduce what the heart does. Another thing I want to point out is that the heart on its own has this intrinsic property of generating its own impulse, electrical impulse, that will allow you to be able to carry out this what? Functions. Am I communicating? That allow you to carry out what? These what? Functions. Now, let's now look at the anatomy of the what? The heart. What is the heart composed of? Basically, we know that your heart is the size of your what? Fist. 3 of us, just do your fist like this. That is the size of your heart. Your heart, the size of your heart is the size of your what? Your fist, like this. Yes. So if your size of your fist is like this, that's how your heart will look like. So let me see your feet. Ask.
What about those people with acronym?
That one is, I say, under normal circumstance. That one, there's an issue there, true of us. Under normal circumstance. Remember, we are not talking about, we're talking about physiology now. Under normal what circumstance. Okay? We'll see, go over to what? Disease what state. Good. You, before you understand the disease state, you must understand the normal anatomy and physiology. True of us, before you can go into that. So what I'm discussing now is under normal circumstances, all things being equal. The side of your fist is the side of your what? Of your what? Your heart. Now, basically, generally, as I said before now, that the cardiovascular system is composed of the what? The heart and the what? The vessels. Now, if you now go to the heart now, you have, the heart basically has what? Has what? Have you heard of pericardium, myo what?
Myocardium.
And what?
Myocardium.
Endo what? Cardium. Have you heard of this before?
Yes.
So the pericardium is is a double layer, both serous and what? Fibrous what? Tissue. Both what? Serous and what? Fibrous tissue. And is filled with fluid. It filled with what? Fluid. It's a double, it's outer layer what? But it's double layer, it's outer doubled layer of the heart. Am I communicating? That is, that is, there's a space in between the two layers. True of us. True of us. So as I said, that it is both what? Serous and what? Fibrous in nature. And it's filled with what? Fluid. What does that fluid do? The fluid surrounds and do what? Protects what? The heart. Are we together?
Yes.
And it allows the heart to free. You know the heart contract, right?
Yes.
Contract, relax. So it make room for what? Easy movement of the what? The heart. If the heart is so confined like this, there is a problem. Two of us. So it gives it that space to be able to do what? Contract and then carry out its what? Function. So I said that it protects the heart, it also permits the movement of the what? Heart doing what? Contraction. Now, the cavity in which the heart sits is called the what? Pericardial what? The pericardial what? Cavity. Is the name of the cavity itself is what? Pericardial cavity. Please distinguish between pericardium and what? Pericardial cavity. Am I communicating? Am I communicating? The pericardium is the outermost what? Layer. Even though it's double layered, in between you have the serous, but we have the pericardium is where the heart sits. It's the cavity. The heart is what? Situated. Am I communicating? Please note this what? Differences. Note this what? Differences. So don't just assume that they are what? The same thing. So the heart sits inside the what? Pericardial what? Cavity. Now, another layer, this is the first layer, right? Another layer I want to talk about is what? The endo what? Cardium. The endo what? Cardium. The endo what? Cardium. So what is endocardium? Endocardium is the what? The innermost what? The innermost what? Layer. It covers where? The inside what? Surface of the what? Of the heart. Are you together? Are you together? That's the what? Endo what? Cardium. What about myocardium? What do you understand by the term myocardium? You've read this, right? So tell me. So what do you understand by the term myocardium? Is what? I'm listening. Silence everywhere. Oh yeah, you're good. Tell me.
Myocardium is that muscle of the heart.
Okay, okay,
Trying to one another.
okay,
They are going to one another so that when they contract, everybody moves around at the same time.
okay. That is even from the name itself. Mayo. Mayo is what? Mayo is from where? Mayo is from where? Mayo is from where? No, wherever you see Mayo, what comes to your mind? It's most open. No. Are you aware? Are you aware? Okay, know it today. Now, that is the main what? That is the one that causes the main contraction of the what? The heart. Am I communicating? Am I communicating? That's one that is excited to cause for it to be what? Contracted. By the time you go into conducting tissues, you talk about the sinoatrial nodes, you come down to atrioventricular node, the bundle of these and what? Purkinje fibers. The Purkinje fibers, no one will get there. So the point I'm making is that this is the myocardium surround the heart and causes the what? That chamber what? Contraction. Know that point. Are we together? Now, apart from the different layers of the heart, we now go over to the chambers of the what I just described now is what layers of the heart. Layers of the what heart. We are going to what chambers of the what heart. Remember we said that from where? Cardiovascular system. We said is what the hearts and the what vessels. The heart, we describe how the heart looks like and everything. We talked about the what layers of the what heart. Now I want to look at the what the chambers of the what the heart. The heart chambers. The heart is composed of four chambers. Four chambers. So you have the material in your phone, so you can easily see the chambers. The color picture, right? Is it color? You can see the color picture, right? So just look at it while I explain. Okay. Now that the heart is what four chamber, four chambers. Now, but basically, see what happens. Basically, the heart has two sides. The heart has what two sides? Two sides. Basically, the left what side and the what right side. The left side and the what the right side. Now, each of these sides is divided into two. Okay? Is divided into what? Two. Each of these sides is divided into what? Two. Now, what are they?
Right ventricle and left ventricle. Right ventricle and left ventricle.
Is it auricle or atrium? Is atrium now. So it has two atria and two ventricles. True of us. So the atria are up, right? And the ventricles are where? Down. This is left. This is right. The two ventricles are down. The two atria are what? Up. So the atrium that is at the left is what? The left atrium. Are we together? Left what? Atrium. The atrium on the right is the what? The right atrium. Then the ventricle in the left is what? Left ventricles. Left. The one on the right is the what? The right. Right what? When actually, which side is actually the left and the right side? Is it here or here is left? Here is left, right?
Yes.
Here I was calling here right. Don't mind me. Here is what? This is actually the what? Here is left. Hope you know.
Yes.
Here is what? Left. Here is what? Right. And here is what? Right. I follow you. Good. Now, right ventricle, left ventricle, right atrium, left atrium. This is the four chambers of what? The heart. Now, what actually happens in these four chambers of the heart? What actually happens in these four chambers of the heart? We are going to physiology now. Hello? We are going to physiology. Let's talk about this now. What actually happens? Was there any question? We have talked about the structures, chambers, what have you. Let us look at the physiology now. What actually happens in the heart? What is the link with the blood vessels? How are they linked? What is the link of the heart, the relationship of the heart and the vessels and the lungs? That's where I want to go into now. Now, Basically, this, this, the right side, their basic role is to do what? Drain blood. We call it draining. Drain blood. Blood is drained into this right and the left, this right side, which is the right atrium and the what?
Right.
And gravity. How does it happen? You know, let me start from one side. You know that blood from different organs. In fact, if you go to every tissue, not even tissue, cells, every cell, that is where the main thing happens. Hope you know. Where the main thing happens is where? In the cells. Cells make up the tissues. Tissues make up the what? Organs. True or false? Now, in every cells, there's what is called cellular respiration takes place there. Am I communicating? Cellular respiration takes place in every cell. Another thing that takes place there. Now, within the cells, when the cell is done with whatever is doing, waste from these cells. Am I communicating? Waste from these cells through the capillaries there, they enter the what? The veins. Am I communicating? Now, the venules, they enter the where? From the capillaries, present in various cells, tissues, and what have you. The deoxygenated blood without oxygen again. Am I correct? The oxygen that was carried to that cell has been used for what? Cellular what? Respiration. The CO2 release after the cellular respiration and other waste, all through capillary movement, they will now drain to what? Venues. Am I communicating? They will drain to where? The venues. As they are drained to the as they're coming out, the one carried by arteries through arterioles is entering. I'll discuss that. Let me start from because everything is taking place at the same time. But let me start from one side. Now, as all this, the blood that has all this waste enter the veins, they will now go down, drain to the veins. Different veins for different part of the body. We call it tributaries of veins. They will drain different tributaries from different veins. They will not drain to major veins. They keep coming up. All of them from your leg up will drain into. There's a part. Even if you look at this picture, you will see the atrium. There's a part that attached to below the atrium. That is the inferior what? Vena cava. Everything will drain into the what? Inferior vena cava. All the ones from your head down, everything will drain through the what? Superior vena cava. They will enter the what? The right atrium. They will enter the what? The right atrium first. What's that? Where will they enter? Ventricle? No. Where will they enter? No, if I'm wrong, tell me. If I'm wrong, tell me. No, if I'm wrong, tell me. Prove me wrong if I'm wrong. No, I say right atrium. She said right ventricle. So let's look at it critically. See, my class is free. I operate a free class. So if I say something you think is wrong, bring it on. We'll discuss it. At the end, we'll find the answer and we'll be happy. Tell me. Okay. 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 Is that what we are told? Wow. Okay, what she was told. Okay, now, okay, look up. It's okay. You know, in the process of learning, you learn, unlearn, keep learning, keep on learning. Okay, just know today that all these things, from superior vena cava If you power, they will drain to the right atrium first. Now, there is a valve between the right atrium and the right ventricle. What is that valve? Tricuspid what? Valve. Are we together? Now, when they drain to the right atrium, when the right atrium, to the function, to the actions of the SA node, go into conducting whatever. When the SA node contracts, this blood will now the valve will open. This blood will now enter the what? Right ventricle. And once it enters the right ventricle, the valve will close so that there will be no what? Backward flow of what? Blood. Am I concluding? Now, in the right ventricle, remember the blood that enters there has waste products and just waste products, whether gaseous or solute. Am I completing? Now, in that right ventricle, the right ventricle will now pump this blood to the what? Pulmonary what? Pulmonary what? Is it valve? Yes, I know that there's a valve. There's a valve between, but where will the blood go first? The blood from the right ventricle should go where? The blood from the right ventricle should go where? Pulmonary what? No? Pulmonary what? Artery. They will enter the pulmonary artery. There is also a valve between the right ventricle and the pulmonary artery. What is that valve? Pulmonary valve. Is pulmonary valve. The valve is between the pulmonary artery and the right ventricle. When the right ventricle contract now, the blood will not, it will open, the blood will not enter the what? Pulmonary artery. It will close. From the pulmonary artery now, the blood is now entering the lungs. Now, the blood will enter the lungs. On getting to the lungs, remember, down the alveoli, you have capillaries, there too, the sac. There plays out exchange, gaseous exchange. The air oxygen you breathe in will do what? Will enter. The oxygen will enter. The CO2 that was carried to that place will leave the what? The alveoli and come out as what? The air will do what? Breathe out. Now the blood in that lung at that point now is now oxygenated. Now the blood will now go back to the heart, to the what? Pulmonary vein. Now when we get to the pulmonary vein, now from the pulmonary vein, the blood enters where? The left atrium. The left what? Atrium. The left what? Atrium. Are we together? Is there a valve between the left atrium and the pulmonary vein? Is there a valve between the left atrium and the pulmonary vein? Now, in the left atrium, listen carefully. From the left atrium, the blood enters where? The left ventricle. True of us? Is left ventricle? Is there any valve between the left ventricle and the right ventricle? And the left ventricle and the left atrium and left ventricle? What's the name? Bicuspid or what? Mitral valve. Mitral valve. Bicuspid or what? Or mitral what? Valve. Are we together? Yeah, long story. Just shut down one. Bicuspid. We know it is atrioventricular. Don't you know that? It's left the name to it, but it has a name given to it, which is what? Bicuspid or what? Mitral valve. Now, from there now, the blood is now pumped to where? The aorta, right? Is there a valve between the aorta, the aorta and the what? Left ventricle. What's the name? Aortic valve. Now, when this is pumped into the what? It will pump into where? The what? They are where? Aorta, right? You know, aorta has how many parts? Where the arch, where the ascending, where the arch, right? where the descending aorta. Now, different branches. Remember, the blood there has a lot of is oxygenated. Am I communicating? So different part of the body that needs blood, it will now be pumped to those different parts of the body. On getting there again, on getting there again, on getting there again, there will also be exchange in those tissues and the cells. When that is done again, another one will blood again without oxygen will start coming back again. This is what the heart will keep doing, turning the blood in the system all over for how many times? 3,071 times in a day. In a day. I know some will ask, the blood in the body is just 5.6 liters. So how come the heart is pumping 4,300 gallons? How? Because of what? One over. They will be through the right side, the blood will enter the system again, the heart. Through the left side, they have to pump it out again. 1 ton. Three of us. Through the right side again, they will enter the heart again, and have to do what? Pump it out again. Second ton. This is what the heart will keep doing under 24 hours. 3,071 times. All right, so I believe this will consolidate your knowledge in what? You have a better understanding now what the heart, how the heart, basically how the heart function. Now let me, we just describe the structure and what causes this whole thing without the conducting system, without the impulses, without the electrical impulse generated at the sinoatrial node, SA node. The heart will just, the muscle, everything will just be like this. They will move. Am I communicating? What moves it is what? The impulse, the electrical impulse is generated by these conducting tissues. That's why they can contract. That's why the muscles can do what? Contract and do what? Relax. Without this, they are nothing like what? Contraction. That's why when they have issues, it's a problem. It will also affect the heart rate and other things that has to do with what? The heart. Okay. Any questions so far? Any questions so far? No question. Okay. So what are arterioles? Let me even know whether you are following me, sir. What are arterioles? Arterioles, what are they? The what? The what? That goes into what? Good. Okay. Anatomically, where does the heart locate? Where is the heart located anatomically? Good morning. Welcome. Okay, let me. When time?
Last time I know that she was basically holding our key. So I'll visit the class, no practical, I'll go. So why is not just told me that she's in the key? But I found the one after being up, take it to the second office. So not it's not personal office. That place is so please, anytime you ever go to secretary, collect the key. If you didn't see the key, look for her. Collect the, you know her now. What's her name?
We don't know.
Awkward now. Okay. So let's see how we can go before your practical. That's ICT what? 301. Okay. It's very important. Let me just round up, okay? Good. You're not serious. I have other schools I want to go now. No, don't worry. I'll come in every day, every morning. I'll be here. Don't worry. I believe in short lectures and long lectures. Am I competing?
Yes.
Short, even if you want 1 hour, you understand. If you grab what you did, tomorrow will continue. You grab, keep grabbing. Now coming one day and pouring everything for 6 hours. Nothing. Your attention will just be divided. You lose focus. At the end, I'll say that I thought. Okay, so let's continue. Okay, so what I explained so far is clear, right?
Yes.
Now remember I said that the without the conduction system, they had to just be there. They had to just be one beautiful fourth chambers looking at each other like this. No, I said that without the conduction system, they had to just be one beautiful structure that has four chambers looking at each other like this. Nothing will happen. There will be no what? Contraction. True of us? Yes. Is this conducting, and this conducting system start from where? Start from where? Start from the where? The sinoatrial node. So I said that this impulse start from where? From your sino what? Atrial node. Where is it located? Who tell me where is it located? Where? Where?
Right atrium.
Right atrium, right? You just a spot there, right? Good. You start from there and spread down to what? Atrioventricular what? No. Then from there it will branch, right? To where? Tell us about it. It seems two of you are professors in the conduction system. You have to tell us. No, feel free. It's okay, feel free. Let's hear you. I like my students contributing in my class. Feel free. Good morning, sir. Feel free. Talk to us. Feel free. No, it's okay. Say the one you know. No problem. Okay. That's okay. Do you know about the bundle of his AV bundle? Okay. Let me not take it that far. But just you know basically that this consists of what? The SA node and the what? Right what? Atrium coming down to where? The AV node, right? Then from the AV node, then the what is it called? The AV bundles then come down to where? The right and left fibers and the what? The Purkinje fiber. In the Purkinje fibers now that the excitation of let me take it stage by stage. What happens in each of the chambers? Then you appreciate it better. Now, I say that this you can call this conduction system or what? Electrical what? System. It controls the speed of the what? The heartbeat. This controls the what? The speed of the what? The heartbeat. Now, what actually happens? It's actually, hope you know that energy. Someone just came in now and she gisting and you are laughing. I don't understand. Where is your notes? Where is your pen? Where are they? Okay, you are not Italian. zukwa n'ike miracle, zukwa n'obere ike. All right, let's continue. So I said, you know that without energy, nothing can happen. True of us. It's energy that moves unmovable. True of us. Without energy, nothing will do what happen. I said that in this essay node, the energy there in form of electrical energy is what lead to all these movements. The energy that originated from the essay node in form of what? Electrical what? Energy. You know, energy can be in different forms, right? It can be solar, it can be chemical. This one is electrical energy originated from where? The what? From where? Essay node that travels as impulse and keep working on all this. The impulse generated from there will keep affecting other parts that put them in what? Action. Am I completing? Good. So this essay node is also a nodal tissue, and at the same time is muscular, at the same time what? Nervous. Is what? Muscular, at the same time nervous. I say that it has the catalysis of what? Muscle tissue, at the same time nervous tissue. Have you heard of excitable tissues before? Excitable tissues. No, it's more when you talk about excitable tissues, you talk about this and this. Okay, they're not what excitable tissues. Don't worry, I think that one is a bit above your level. All right. Now I say that this essay, they have both what? The features of what? The muscle tissues and what? Heart what? And nervous tissues. Are we together? Are we together? Now, this electrical impulse from this SA node will now move down to cause the heart muscle to do what? Contract. That actually what causes the heart muscle to do what? Contract. Any issue at that point, what you know? Any issue at that point, what you know? Agusigo, am I communicating? The blood will not pump. True of us, nothing will happen. So it's a very important thing you note. Now, because of what I said about this impulse generating from there, you can take this to be like the term we call auto-rhythmicity. 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 What it means is that the heart on its own generates its own what? Impulse. Its own electrical what? Impulse. So whenever auto means own, right? Self. Auto, you yourself, you can do this yourself. It doesn't need any help from anywhere. No now from anywhere that will come and do it for it. Am I committing? It's on its own, generate it on its own. That is because, let me ask you a question. Which organ in the system that die last when somebody die? Which organ dies last? Just the liver. Do you know? The brain. The brain. Which organ in the body dies last? I said, when other that one is last to give up. Which one? Check it up. Check it up. Check it up. Check it up first. Let's not talk. Check it up. We are getting different answers. Check it up now. The organ that when somebody dies, the organ that dies last, as in that is the last organ to give up finally.
The brain is usually considered to be the last organ to die. Even after the heart stops beating and breathing ceases, brain activity can produce a short period, although it usually declines and eventually stops.
Okay.
That's the brain.
The brain. Let's continue. Let's continue. These things are small ingredient to add. You keep growing, okay? Let's continue. Now, so that impulse, are you together? That impulse that is generated within the what? SNO is known as what? Natural what? Pacemaker. Natural what? Natural pacemaker. The impulse generated within the what? SNO. That electrical impulse in question, that electrical impulse we've been talking about since is called is known as what? The natural what? Pacemaker. Now this impulse continues and enter the where? The AV node. Okay? It enter the what? The AV node. AV node is also known as what? The electrical what? Bridge. Electrical what? Bridge. Electrical what? Bridge. Then from the AV node, it will enter the what? The common AV what? Bundle. Or simply bundle of what? His. Bundle of what? But once you say bundle of his, bundle of what? Bundle of his, as in his. Bundle of what? His. The AV bundle is, we have AV node. We have AV what? Bundle. So the AV bundle is known as what? Bundle of what? His. Please know that point. Bundle of what? His. Bundle of what? His. Each of these I've mentioned, there are other terms I have mentioned here since. Note them, because some question you see, you may see outside may not may ask just the same way we were talking about. You told me about atrioventricular what, left atrioventricular what valve, and as I said, it's also known as what, mitral valve. That is well. So you know this because you don't know the nature of question you will see. You may see bundle of his, you become confused. Which one is bundle of his again? Please know that point, okay? So this now from the AV node down to where the common bundle of his, or simply what? Bundle what? AV bundle. Through the left and right bundle branches. It has left and right what? Bundle branches and Purkinje fibers. Don't worry, by the time we go into each of the chambers, what actually happens in each of the chambers, you now understand what these Purkinje fibers actually what do. Are we together? Are we together? I keep repeating this. I keep saying this. I keep saying this. I keep saying this. The contraction, this electrical impulse results in what? Contraction. But the atria and the ventricles, they don't contract at the same time. The atria contract first. About 1/10 seconds later, the ventricle will do what? Contract. Am I communicating? The atria contract first. The atria contract first. About 1/10 seconds later, the ventricles do what? Contract. Do you know why? The atria, if they contract, they need to give space for the ventricles to get filled before they do what? Contract and continue the what? Movement of the what? Blood. Remember, this whole thing is happening simultaneously. Hope you know. The two atria are at the center. Hope you know. Because if there's a delay, there will be congestion. True of us? True of us? Yes. So there's no what delay. The only gap you will experience is between the atria and the what? Ventricles. Am I communicating? All right, please note this point. Note this point. So now when the heart what is the difference between heartbeat and heart rate? And heart rate. Tell me. Who can tell me the difference between heartbeat and heart rate? Tadam. Oh yeah. Is it what? Say it. Tell us. Say it anyhow.
Heartbeat in the heart
In a bit. We don't know, so tell us. Allah invented. Kekosi, Motu, I will go to, who knows? Tell us. You, okay. Tell us.
How many minutes is that? Well, heart rate, like how fast?
You're saying something now. You define heart rate. Heart rates.
The heartbeat is like that contraction. That contraction.
Time. Remove time from it.
The period.
Remove that period.
The thing when the contraction takes place. The heart rate is the frequency at which
Who can give this thing a flesh? You try. You have given us bones. Who add flesh to these things? To this definition. Better now, talk to us. Talk to us here. Who help us? What's going on here? Heartbeat and heart rate. What is the difference between heartbeat and heart rate? You know, are you sure? That's good. I like that. That's good. Please clap for her, please. Okay, they don't hear you. Speak out. Okay.
Why heart rate is the fast movement.
The rate. So each contraction represents a heartbeat. Okay. You try, but the flesh, I don't shout.
I was the one that put the flesh in.
Yes, you put the flesh. But two of you did well. Yes. So I said, listen carefully. The heartbeat is that contraction. Remember, contraction is a result of what? The impulse, right? Good. Now, each of these heartbeat represent a contraction. So each of these contractions represent a heartbeat. But heart rate talks about number of these beats or contraction in a given time. Heart rate talks about what number of this contraction or heartbeat in a given time. I said that heartbeat is the contraction of the heart. So each contraction is one heartbeat. And I said that but heart rate talks about what? The number of these contractions in a given time. For a healthy human being, the heart contracts or beats 60 to 100 times in a minute. In a healthy human being, the heart contracts or beats 60 to 100 times what per minute. So that time you go to the hospital, they want to check your pulse. What are they checking? The heart rate, right? Yes. You see something like 70 beats per minute. True of us, or if you have 200 beats per minute, what does this say? Problem. So, issue profundus. Are you clear on this now? So please, let's know these differences. Okay. I've also mentioned that the atria contrasts after like 1/10 seconds before the ventricles will do what? Contract. So the atria contract about 1/10 of a second before the ventricles contract. This is allow the what? Atria to empty the blood into the what? Ventricles. Before the ventricles now does its own what? So if the two of them are contracting at the same time, with the atria be able to empty their blood. The person you are giving the blood to take is busy contracting. So what will happen? The blood will go back now. True of us. Maybe you know this relay now, this relay, this thing. I will batten. I'll run to give batten. If you are not in position to receive the batten will fall off now. True of us. So the atria should contract first. You know that when you say that contraction signifies emptying the what? The content. Hope you know. Pouring to the next one. So if the chamber that you are trying to pour the blood you empty the blood you as a result of your contraction is busy contracting at the same time, there's trouble. There's a very big what? Trouble. So that 1/10. Wait, did you reason into this 1/10 60 seconds? Do you know what a seconds means? That is 0.1 second gap to tell you how busy the heart is. Just 0.1 seconds gap, very fast. God is wonderful. I don't know what God created here. I don't know. I don't understand. I've been thinking about it. After thinking about it, I just said, man. Anybody that says that God does not exist, that person is a fool. The person is a fool, big time fool. How he designed all these things, and they keep coming up from one generation to generation. Please let's clap for God, please. Let's clap. Even if you don't believe in any religion, believe that there is God somewhere. On the most just note, the worst thing that I want to do is that you say that you are an atheist. You are gone. You may say you don't want religion. Fine, no problem. It's your business. But know that God exists. Is that what? Purple and red. Okay, you know this one is not. Okay, here. Okay, thank you very much. Let me see. The purple, what you think it? I like that question. It will help you to explain it. That the purple is what? I have here, but this is a printer. This is black and white. So what is the letter? What is the write-up on it? Label on it. When you say oxygen rich, let's take care. If you say oxygen rich and CO2, you talk about what? Oxygenated blood now. So where is it coming from and where is it going to?
It's coming from
where? Oxygen rich. God bless you. You go far. From where? It's in the lung that it will become oxygenated, right? So it's moving out from the lungs to the pulmonary vein to the what? Left atrium to the what? Left ventricle that will not pump it into the what? Aorta, it will not go to the systemic circulation. Two of us. So, and that oxygen rich is pouring what? CO2. Because it has already emptied the CO2 in the lungs. Two of us. It will empty, as it's emptying the CO2, this thing takes place simultaneously. That's why it's called gaseous exchange. As it's emptying the what? CO2. Oxygen is entering. True of us? Good. Is it clear now?
Yes, sir.
So the second one is the second one has no issue now. That one is what? Deoxygenated. That comes from the part of the body back to what? To the what? Inferior superior vena cava, to the right atrium, to the right ventricle, to the pulmonary artery, to the what? Lungs. To get what? Oxygenated. True of us? It's clear, right? So let's move on. I like that question. Thank you very much for that. So let's continue. So I say that just 1/10 seconds so that it will be able to do what? Empty the blood to the what? The ventricles. Now, this delay occurs, listen carefully, listen carefully. You know that it started from, where does it start from? This impulse start from what? SA node. Now, as do you know why the atria contract first? The SA node is starting from where? The right atrium, right? So the atria will get the blessing first, right? And contract. So before you get to the delay, is that time it will take it to get to the what? AV node. Before it will now, you know that when you get to the AV node, that's when the ventricles will now have their own share of what? The contraction blessing. Three of us, before they will now do what? Contract. That's why you have the delay. Okay. Atrioventricular, atrioventricular, between atrioventricular. So the ventricle is now involved, but this ACN is only the what? Atria alone. So before you get to, it does not just fly like that. It travels from node to node. Two of us, it does not fly anyhow. There's a pathway it takes. There's a channel it takes. Okay, it's not just anywhere where it is going. No, it will follow that channel. That's why by the time we get down to Purkinje fibers, we see. I will still talk about it. You understand that that's a pathway it takes. The same way you say your lymphatic system follow channel, your blood follow its own what? Channel. The same thing. These impulses follow its own what? Channel. It's not just scattered anyhow. All right. Let's continue. So I said that the delay occurs when impulses reach the what? AV what? Node. And they are then sent to the what? The AV bundle. Hope you're following now. What's the name for AV bundle? Bundle of what? His, right? So the delay is because of what? Because when the impulses reach the AV node and they are then sent down to the what? AV bundle. So this AV bundle now branches off to two main what? Bundles. So from there now, they will now go down to the heart of the center of the heart, to the left and the right ventricle, terminating as what? Purkinje what? Fibers. From the, and this is just that channel I talked about. From the SA node down to what? AV node, to bundle of his, which branch into bundles, two bundles, right? That will now get to left and right ventricle. That terminates as what? Fibers, called what? Purkinje fibers. This is the pathway they will take. The impulses we go like that. So that means this one contract, it will wait for this before you get to this tongue, this place, it will do what? Contracts. So if you understand it this way, you are good to go. So by the time we go, okay, let me continue. So I said that they divide further into what? Purkinje what? Fibers. Now, when the impulse get to these fibers, see what happens. They will trigger the muscle fibers to do what? Contract. So when the impulses get to the Purkinje fibers, they will trigger the muscle fibers to do what? More fibers of the ventricular muscles to do what? Contracts. You see the implication when we go to the cardiac cycle. When we go to the cardiac cycle, you now see the implication of all this long story I've been saying, telling you here now. When we go to what? The cardiac cycle. So what is cardiac cycle? What is cardiac cycle?
The pattern of events that occur.
Simple. During in a heartbeat, all the cardiac event that occurs during the what? Heartbeat. So it's a pattern of event that occurs when the heart beats. It's called what? Cardiac cycle. There are two phases of cardiac cycle. We have the diastole and what? Systole. So that's where this thing you will be hearing, systolic blood pressure, diastolic blood pressure. That's where they came from. Yeah. I say this, I say the cardiac cycle is nothing but what? The pattern of event that occurs when the heart beats. And it's that this cardiac cycle has two phases. The first phase, we have the diastole. The second one is what? Systole. Systole, diastole, or diastole. It's not diastolic pressure now. This is simply what? Diastole and what? Systole. So what is diastole? Let me explain so that when we go over to high blood pressure, when I mention systolic blood pressure, you now understand what it means. Okay? Good. You know, we just learned here systolic blood pressure without even knowing what it means. Two of us. Yeah. So now, what is diastole? Diastole is when the what? The ventricles does what? Do what? Relax. That is what? Diastole. If the ventricle need to relax, when that time they relax and blood enters, that's what? Diastole. But systole is when the ventricles contract. When they contract to pump their blood, the blood inside them, is that cardiac event is what? That. So actually, the cardiac event is just an alternation of what? Diastole, systole, diastole, systole, diastole, systole, relaxation, contraction, relaxation, contraction. Simple. That's cardiac what? Cycle. It's all about what? Relaxation, contraction. Relax, blood enters. They contract, the blood goes. That's what the heart does. Hope you know. Relax, blood enters. Contract, blood goes. Relax, blood enters. Contract, blood goes. That's what they keep doing for 3,000. So they turn the blood in the whole system for 3,071 times. This is what the heart keeping higher. This heart self. That's why you should take care of the heart too. What the heart keep doing? Relax, contract, pump blood enter. Pump, contract, the blood goes. It open again, blood enter. Contract, blood. That's what the heart keep doing. Eh? Now, as and if there is any delay in any of this, new issue when you only issues moves, any delay at all, when you new issues moves, okay. So let's continue. So let's now take them one after the other. Okay. So let's look at diastole. Listen carefully. Listen carefully. Let's look at the diastole. Remember, we say that the diastole, the what happens? It's actually, thank you, I like that. But you know that the one that is more significant, more pronounced is what? Ventricle. That's why they keep talking about what? Ventricle. Because that's where the main pumping occurs. Two of us, everything pumping is in where? Ventricle. Either it's pumping to the lungs or pumping to the what? Aorta. Is what? Ventricle. Okay, let's continue. So doing that diastole, both the atria and the ventricles are relaxed. So when they are relaxed, now the atrioventricular valve will do what? Open. Hello? The atrioventricular valve will do what? Open. What are the atrioventricular valves? Try what? Phosphate. Triphosphate. I heard triphosphate now. Triphosphate. Okay. So now when they relax now, when the atria when they are relaxed now, the atrioventricular valves will do what? Be open. Now when you open, now the blood now enters the what? Ventricles. Blood enters the what? Ventricles. Now when the blood enters the ventricles, now it depends on which is which. If it is in the left side, if it is in the right side, what happens is that the oxygenated blood will do what? If it is remember I said doing diastole, the atria and the ventricle, they do what? Relax. Atrioventricular valves do what? Open, right? and blood will do what? Enter the what? Ventricles. We didn't mention the particular ventricle, whether it is right or left. But if the Bible says that this happens simultaneously in the right and left at the same time. So let's look at what happens in the left and in the right side of the heart. If in the right side, now what is the implication? What that the blood that enters the ventricles is what? Deoxygenated blood from where? Superior and inferior vena cava. If it's in the right side, true or false, then the blood and it will relax. The blood from the superior and inferior vena cava enters the what? The from the right atrium. Of course, they enter the right atrium when it relaxes. Then with the valve that is open, they will enter the what? The right ventricle. Are we together? Now, but if it is that is diastole, and that same diastole, as what is happening in the left side is also happening in the what? Right side. Now, what happens in the left side at that point in time? Oxygenated blood from where? We do what? Good. That is open. You do that the left ventricle. Good. You will not say, because they have to not say, please, the left, Sharon. Can they right, Messiah? Oh yeah, two of us. You will not say, the left, because Sharon, can they right, Messiah? Because you just die. Because the tissue need just see other parts of that, two of us. So they're happening simultaneously. So as the once in that diastole, once the atrioventricular, two of them, the valves are open, blood will just enter. Right as the blood from the superior inferior vena cava entering the right atrium is entering the right ventricle, blood from where? From the lungs, from the pulmonary vein is entering the left atrium and is entering the what? Left ventricle at the same time. So they happen at the same time, simultaneously. This is what happens in what? Diastole. Is it clear? Good. Now, remember, what led to this is the essay. Remember, impulse from where? Essay down. Okay, let's continue. So the essay, ask.
I said the essay is for the right atrium.
Yes.
And is that it helps in that contraction?
Yes.
In the left atrium, what helps?
No, it's origin. It originated from there, and you know this, and you just started from there. That is origin, where it starts from and spread. You know it has channels now. It touch every other part. Is it clear? Good. Okay, so the SA node contracts and pump. Listen carefully. The SA node contracts and prompts. It contracts and prompts. Remember, I said that the SA node has muscular and nervous what? Characteristics. Remember, it will contract and do what? Prompt the atria to contract at the same time. The two of them will contract at the same time. Of course, when they contract, they will pump their blood now, right? I'm trying to explain what actually led to that pumping of blood. Is that the SA node contract and prompt the two atria to do what? Pump their blood. While the right is pumping its own, the left is what? Pumping its own at the same time. So if you pump them, they will not pump their blood and become empty, right? If they become empty, all the blood will enter the what? Left, the ventricles. Good. Of course, once they enter the ventricle, the valve do what? Close up to avoid what? Backward what? Flow. Good. So this is what happened in what? Diastole. I believe if you are called out one day to discuss what happened during diastole, you can do that. Maybe in a seminar. You can boldly stand and rap. Two of us, you can do that. This is what happened in diastole. This is when they are relaxed, when the blood enters the what? Ventricles. Two of us, good. Now, let's go to what? Systole. What actually happens in what? Systole. So, during systolic phase or systole, Mwafa. During systole, listen carefully. Listen carefully. During systole, that impulse will be received by the what? Ventricles. All together. That impulse that has already started coming down will get to the what? The ventricles. They will receive that impulse. So during the systole, the right ventricles receive electrical impulse from the Purkinje fiber. Remember I said that these they terminate as fibers in the muscles of the what? Ventricles as what? Purkinje fiber. So they receive impulse from where? Purkinje fibers. When they see that impulse from Purkinje fiber, they'll do what? Contracts. Are you together? You're confused. What is that? Tell me.
Because from after the essay, you said electrical impulse.
Node.
Every
If you know, yes.
then we have to carry it.
Yes, you're going down now. Essay node. Only the A2 are only the A2 are involved here now. When the essay node contracts and the impulse emanates from there, did you hear anything particular? Only the atria, because that is where it is at that point in time. But you start coming down and get to the atrioventricular, it's now touching the ventricle now, node, to the bundles. It's the bundle that divide that end up in fibers inside the muscles of the what? Ventricle, as what? Purkinje fibers. This is the channel the impulse will now flow. And the ventricles now will now receive the impulse from the Purkinje fibers, and they will now contract to pump their what? Blood. Is it clear now? Is it clear now? So I said that during the what? The systole phase, the right ventricles, or simply the ventricles do what? Receive electrical impulses from the where? Purkinje what? Fibers. And when they do that, listen carefully. When they receive the fiber, sorry, they remember that the Purkinje fiber is also there, enters there, right and left. When they receive that impulse, simultaneously they will do what? Contract. Two of them. They will contract simultaneously when they receive that impulse from the Purkinje fibers. They have no business. The impulse they are receiving started from SA node. It came down to the Purkinje fiber, where the one that touched them directly is what? It is that same impulse that came down to them through what? Purkinje what? Fibers. And when they receive that impulse, they do what? Contract. So, during the systole phase, the right ventricle receive electrical impulse from the Purkinje fibers and contract simultaneously with the what? Left ventricle. Listen carefully. The atrioventricular valves, of course, they close now. They are very close now. Now, the semilunar valves, another name for these two valves, you can call them. They are semilunar. They are semilunar. Two of them are those other valves. Okay. The left atrioventricular valve can also be called what? Semilunar what? Valve. That is, what are they? The aortic valve and what? And what? Pulmonary wall valve. Two of us. You can call them left. What is it called? Atrioventricular, or simply what? Semilunar valve. So this valve, any issue? No issue. Alright. So this valve will do. Listen carefully. This valve will do what? They will do what? They will open. Do you know why they need to open? Because the blood from each of the ventricles need to leave. The one from the right ventricle needs to enter the what? Where? The one from the right ventricle need to enter where? The pulmonary artery. Two of us. While the one from the left ventricle need to enter where? The aorta. So the valve need to do what? Open. While aortic valve is opening, pulmonary valve is also what? Opening. Am I communicating? Now, so when this happens in the right side, the oxygenated blood is entering the lungs, three of us, while oxygenated blood is entering the aorta in the left what? Side of the heart. This is what happened in what? Cardiac cycle. is a succession, alternation of what? Contraction, relaxation, contraction, and each contraction is a heartbeat. So what it means that once anytime your heart beats, there's a contraction, true or false? And blood is what? We'll stop here for today. In our next class, we'll continue for what? Disease of the what? Go and assimilate this first. Understand it first. Are we together? Go here into the world of this, assimilate it and understand it.
So we're not tired. Okay, I see like okay, BDT.
Please, two experts have been walking around here. I should not be that selfish. We have tried. At least I've said one over here, right? How many hours has this read?
1 hour. 1 hour.
Please, see. Me personally, I don't believe in long lectures. So. I don't believe in that. I don't at all. I don't believe in long lectures. 1 hour lecture is okay for you to understand what you need to understand. Go and assimilate it. Next time come again, no problem. If I want to go out, by God's grace, I should hear. So we'll continue from disease of the heart. When we are done with disease of the heart, we'll now enter into treatments, drugs, and what have you. Okay? Are we together? Good. Please, you see this question at the back. Digest these questions. Tanya Jaja. Tanya Jaja. If you know, you know. Atwala malo. Malo. Atwala feke. Fenyi sinabia. Bila yake na kwa munu. Osona na. Osona ni gobia. Okay, isi ya mara asu. Osona ni kuna. Mara asu na gire. Osona. Ada go etin na gire me. Ayesu. Ngoje leje. Anani yu. Ugo le aka. America le aka. All right. Thank you very much for your attention. See you tomorrow. God bless you.
God bless you.